Hello everyone, my name is Dr. Christy McRaney and I'm the Director of the Center for Behavioral Health here at the University of Southern Mississippi. I'm popping in to tell you a little bit about our fundraiser, Unlock Potential. So this fundraiser is an effort to raise funds to fill the gap of funding that we need for a training that we are bringing here to Hattiesburg for an autism evaluation skill. What we are seeing right now is that with increased awareness, as well as a lot of delays in ability to conduct specialized evaluations for autism during the pandemic, we're seeing a lot of a wait list, a bottleneck of service need for children with autism. We're seeing that here in the center, across the community, and across the nation. One of the reasons that there is that bottleneck is supply and demand of service providers that can actually conduct these evaluations because of the need to have a specialized skill set with a tool called the Autism Diagnostic Observation Schedule, 2nd edition, or the ADOS-2 for short, which is the gold standard tool that is one of the most widely used tools in assessing criteria and symptoms of autism for children and adults. And of course, in the context of a larger comprehensive evaluation, but this is often a key piece of that evaluation. To conduct the ADOS, that requires specialized training that is expensive and is usually a 2-day at minimum training. Here at the CBH, we are lucky enough, Dr. Zachary LeBrat and myself applied for funding from Autism Speaks and got $5,000 to bring that very training right in Hattiesburg. And we are so lucky for that and so grateful for that. But that money doesn't cover all the expenses. We still have about $1,500 of expenses that we need to cover, which is why we've launched the Unlock Potential fundraising campaign. That money is going to directly go towards hosting this training, which will result in us going from just 3 providers in the Center for Behavioral Health to over 60 providers in the Center for Behavioral Health that can conduct these type of evaluations. That means that children in our community will not have to wait as long for an autism evaluation, which is such a critical piece of the puzzle for them. If you're wondering why timing matters because the quicker we can get a kiddo in for an evaluation, that means the quicker we can connect them with interventions they need for autism. And what we know is autism and early intervention for autism is incredibly important and impactful. It is one of the most important things that we can do for a child with autism, but insurance requires a diagnosis of autism before they can get those things that they need to get that evaluation fast. They don't need to wait a year just to know an answer to then get onto a wait list for that intervention. So by bringing this training here, this ADOS-2 training, we are going to see a direct benefit right here in our community. I'm not sure if this is something that you've been impacted by. If autism is something that has impacted your life, your family's life, 1 in 44 children will be diagnosed with autism by age 8. That's the most recent statistic from the CDC. 1 in 44 children. There is a good chance that autism will impact and touch your life at some point. So this fundraiser is personal for all of us. And so this holiday season, I ask that you consider donating just $5 even to our fundraiser to help us fill that gap so we can bring this training as early as January. We're slotted to bring this training here to USM in Hattiesburg in January, which is amazing. And I know times are tight, so if you can't afford to donate, perhaps consider going ahead and sharing our fundraiser. Somebody you may know may be able to support our fundraiser. Go ahead and go to eaglefever.usm.edu/unlockpotential to donate now. Thanks so much and happy holidays.